Good morning. My name is Efernstrom, and I appreciate you taking the time to be here. Susan B. Bastable, in her book, The Nurse as an Educator, Principles of Teaching and Learning for Nursing Practice, describes a learning theory as a coherent framework of integrated constructs and principles that describe, explain, and predict how people learn. Today, I'm going to discuss aspects of 5 different learning theories and how they influence and change in behaviors and enhance learning. Let's first talk about the behaviorist learning theory. This theory is based upon a person's response to environmental conditions or stimulus. Changing the environment or stimuli can change a behavior. To increase a positive behavior, a parent, for example, can use positive reinforcement when a child is behaving appropriately in order to motivate the child to continue their good behavior. Applying this to nursing, Bastable gives the example of a patient who is struggling and moaning about having to get up and ambulate after surgery. If the nurse and staff provide an abundance of praise and encouragement, the patient will likely be motivated to continue efforts to ambulate. Conversely, the behaviorist learning theory can also be applied to decrease a negative behavior. This would be achieved either through non-reinforcement or punishment. By not providing acknowledgement of an unwanted behavior, it removes any of the tension getting associated with the negative behavior, hopefully eliminating the motivation for the unwanted behavior. The example of a parent ignoring a child who is throwing a tantrum is a clear, understandable example of non-reinforcement. Transferring this concept into the classroom might not acknowledging a student who is being disruptive. If the disruptions gain attention, it is likely the motivating factor for the behavior. Ignoring the behavior may remove the motivation and reduce the unwanted behavior. The other option of punishment in the academic setting may be in the form of a decreased grade or losing privileges. Great care must be given to ensure that the punishment is fair and directed only at the behavior and not the person. Because the behaviorist learning theory is less popular today than it was a number of years ago, it is most often used in conjunction with another learning theory, such as the cognitive learning. So let's look at cognitive learning theory. Can it be used to increase or decrease behaviors? Cognitive learning involves an individual's perception, memory, and thoughts, as well as the way a person processes and structures information. It also involves interpretation, memory, and how an individual organizes that information. One of the challenges as educators and nurses is first ascertaining how a patient and/or student perceives and processes information. It is important to note that a person's perceptions and attributions may or may not promote health and wellness. The one sentence in all of my reading about cognitive learning that resounded loudly to me was that, quote, "The route to changing health behaviors is to change distorted attributions." Unhealthy distortions in thinking and processing will make it very difficult to teach healthy behaviors. Therein lies the challenge. Next, let's look at social learning. This theory recognizes that learning is a social process, that other individuals such as parents, significant others, teachers, etc., become role models for behaviors. Additionally, there is the component of vicarious reinforcement. This refers to the observation that the role model's behavior is viewed by the observer as either rewarded or punished. This observer can have a strong influence on whether the observer is influenced by the role model and hence emulates that same behavior. Perhaps an effective way to use this theory to either increase or decrease certain behaviors is to learn who the person's role model is and, if needed, introduce a role model who has the desired behaviors that are sought to be adopted or eliminated. By giving the observer an appropriate role model to follow, this will tap into their social behaviors and may promote change desired. Now let's talk about the psychodynamic learning theory. While this is not always considered a learning theory, it references the concepts and theories proposed by Sigmund Freud. This includes id, our primitive drives, superego, one's internalized societal standards and values, or the conscience, and then the ego, which is the mediating force of id and superego and is based in reality. When we look at teaching and how it relates to the psychodynamic aspects of learning, the theme that comes to mind is the importance of being a dynamic, motivational speaker. Tapping into the emotions of the learner can enhance the learning that takes place. A dull speaker with no emotional hooks in the lecture has less chance of stirring that deep emotional drive that makes us wake up and pay attention. To support this theory, understanding Kubler-Ross's stages of development can help to effectively teach and motivate our patients. As a nurse or teacher, if we have a student or patient that is struggling, gaining an understanding of their underlying emotions and struggles can help to find an effective tool or way to reach, teach, and motivate them. We can keep this in mind as well when we have a patient that is non-compliant or that is resisting or struggling with some aspect of their care. Next is my favorite learning theory, the humanistic learning theory. It is based broadly on the assumption that all people have an underlying desire to grow and improve in a positive way, and as well acknowledging that each individual is unique. Humanistic theorists assert that self-concept and self-esteem are a necessary part of learning environment. Therapist Carl Rogers asserts that people want unconditional love and respect, and further that environments that are threatening, judgmental, or coercive actually undermine a person's ability to learn. Additionally, humanists contend that an educator should not be acting in authority, but more of a role model, facilitator, and leader. Listening is more important than talking. Mastering facts and figures is not the main goal, but rather fostering curiosity, motivating the learner, and creating an environment that encourages the learner to take the initiative to do well. Conversely, some contend that this philosophy of learning misses the important point that learning facts and information, in fact memorization, is actually a necessary part of learning. Some naysayers actually assert that the humanistic learning theory is more of a philosophy or even a cult rather than a science. I personally contend, why can't we have both aspects? By being a motivator, facilitator, and role model and showing respect for all, as a nurse or educator, we should be able to motivate our patients or students to learn the facts and figures too. These facts and figures per se can provide a basis for understanding the disease process or give the nurse foundation for appropriate critical thinking. I personally believe that is possible to incorporate both. Specifically addressing how to employ the humanistic learning theory to either increase a positive behavior or decrease or eliminate a negative one is simple. Encouraging self-love, self-esteem through respect, role modeling, and encouragement will give the learner a foundation and desire to improve their lives by developing good habits and eliminating old ones. Now that we've reviewed 5 different learning theories, how can we use these theories in combination to enhance learning or bring about a greater change in behaviors? The first combination that comes to mind for me is incorporating the cognitive learning theory and humanistic learning theory. This combination taps into the emotional side of and the cognitive or intellectual side to hopefully enhance learning. Also combining the social learning theory and humanistic theory could enhance learning by finding a positive role model that has a huge impact on the learner, as well as tapping into the humanistic emotions of feeling self-love and increasing self-esteem to really solidify the acceptance of the role model's influence. Now let's take a look at 3 different scenarios and how different learning theories might apply. First, you're a staff nurse preceptor and you find that the nurse orientee you're working with has difficulty understanding the idea of titrating drug doses on the basis of physiological data. A weakness in which type of learning might be the underlying to this problem. Also, in addressing this orientee's difficulty, what other information would you collect? The challenge of this orientee in grasping this technical aspect of nursing would likely indicate that this nurse has challenges with cognitive learning. It would be important to take into consideration that they might have underlying issues that lend to this particular challenge. Perhaps the orientee has experienced an authority figure, such as a parent, who has undermined their self-confidence when it comes to math. Or perhaps the orientee has always struggled with numbers and math growing up in school. I would take the time to inquire about the orientee's thoughts and feelings around their struggles with the process. Also, look for ways to build up their self-esteem and confidence. These 2 activities could relate to the psychodynamic aspects of environmental influences, i.e., negative messages from a parent, as well as the social learning. As a preceptor, I would work to incorporate the humanistic approach to tap into the orientee's desire to be successful and also to build up their self-esteem by pointing all their accomplishments as a new nurse. I would also incorporate some cognitive activities to bring in the actual hands-on practice of titrating medications, incorporating perhaps pictures and scenarios to teach rather than just math problems. Touching on multiple senses can certainly enhance learning by bringing technical and emotional aspects together. For the second scenario, we have an instructor who is needed who is needing to counsel a nursing student who is failing a nursing course. How would using the self-efficacy theory differ from using the principles of attribution theory? Realizing that attribution theory is mainly based on cause and effect relationships, such as a person basing their own behaviors on others' behaviors and generally their belief in how the world operates. This includes like religious beliefs or parental upbringing, for example. Whereas self-efficacy theory is based on a person's belief that they are competent and capable of accomplishing a specific behavior or task. In counseling a failing student, by focusing on self-efficacy, an instructor could focus on gaining an understanding of the student's self-perceptions of their abilities. Do they believe they're smart enough, for example? What is their self-esteem level or challenges? Gaining these understandings can give the instructor information on how and where to build up the student's self-esteem to help them believe they are capable. Pointing out their successes and building on those successes is also very important. The third scenario I'd like to discuss involves social cognitive theory. As a clinical preceptor in a health agency, how would the social cognitive theory come into play in teaching a preceptee? Remembering the social cognitive perspectives highlights the influence of societal factors on a person's learning. These societal factors include perception, thought, and motivation. Consequently, the teacher or preceptor in this scenario needs to understand the influence of ethnicity, race, religion, family, for example, when interacting with the preceptee. It is important for the preceptor to consider these influences on both the interpersonal and intrapersonal aspects and behavior of the preceptee. Understanding where the preceptor is, quote, coming from, unquote, in their learning and interactions with patients and others is invaluable to help guide and teach effectively. So in summary, I'd just like to point out the value and benefit of having an understanding of the different learning theories and how they can apply to our interactions with patients and learners. Being able to draw from these theories to be the most effective example and teacher in whatever situation we find ourselves in makes us better people, mentors, nurses, and teachers. So thank you so much for your time, and now go forth and conquer.